Hello, everyone. It's another day with your fertility specialist. Welcome back to our Friday episode on a day with your fertility specialist. Thank you so much, viewers, for always staying glued to your screen, for always engaging us. On behalf of House Hospitals, we love to say a very big thank you to you all. As we get started, please call up someone, share this link with someone. Feel free to drop your thoughts, your questions in the comment sections, your opinion as well in the comment section. I will definitely attend to them. For this session today, I'm your host, Ruth Ogogo. And with me is a special guest, as always, Dr. Kenneth Eguda. Dr. Ken, welcome to today's session. For the sake of someone watching for the first time, a bit about Dr. Ken. He's a consultant gynecologist, he's a minimal access surgeon, he's a fertility specialist. As a matter of fact, he pioneered laser gynecological surgeries in Africa. So it means that this talk we have today, you couldn't have had a better person talk about it than we have with us today. So Dr. Ken, we're glad to have you with us.
Thank you, Ruth.
So we're talking about when fertility needs advanced testing. Well, I now hearing advanced testing. Are there some basic testings that people actually do with respect to fertility before we even talk about the advanced testing to begin with? What are basic testings that you specialists, fertility specialists will recommend before you now say, okay, this person needs to go for a higher form of testing? Oh yeah, before we get there.
Yeah, basic testings usually, how the basic tests
Yeah.
are often the blood work,
Okay.
the hormone profile of the woman.
Mm.
And among the hormone profile, you have things like the follicle stimulating hormones, luteinizing hormone, prolactin, testosterone, then the thyroid function hormones.
Yeah.
The thyroid functions hormones, thyroxine, thyroid stimulating hormone.
Okay.
Yeah, the names will be just too big for these
People to
for the people to understand.
Yeah.
And then the AMH, anti-Mullerian hormone, it's a hormone that shows whether or not the woman has chances of producing eggs or good eggs. Yeah, then other tests that may just be peculiar to the woman or to the couple, of course, the sperm analysis, the regular sperm analysis, where you see the morphology, the physical morphology, the movement of the sperms, the count of the sperm, the shape of the sperms, and of course, whether or not there are bacteria cells or bacterial cells in the sperms. So the sugar tests, either the fasting sugar or random blood sugar. So these are basic tests that are done. Of course, the infection screening, chlamydia, very important. Expected that a good number of women should have chlamydia testing before doing an IVF. Chlamydia, then HIV tests, hepatitis B, hepatitis C, and all the other panel of tests that should be done. And for some women, depending on the state of health, they may need liver function tests. They may need kidney function tests, the electrolytes, and all of that. So these are basic tests that should be done, plus ultrasound scan. Yes. Yeah, so these are basic tests that should be done.
So if you have maybe a very young couple, to just say, well, we just want to check ourselves to see, do you think that checking the woman's tube will be so much extreme if they say they are wanting to come to check their fertility status, for instance? Checking her tubes, do you think that will be extreme because of the pain involved with checking the woman's fallopian tube?
Checking the fallopian tubes doesn't necessarily have to be painful. There are quite a number of modalities that could be used. The sono HSG, for instance, is not as painful as the HSG that you do in the X-ray department or X-ray units. that can be done. But even if it's HSG itself, I've worked in places where HSGs were painless.
Wow.
Oh yeah, like in one of the hospitals I worked in Bulgaria, for instance. Yeah, in the gynecological HSG department, the women are given anesthesia.
Wow.
So they don't even know they have anything. So they just get drowsy when they are when it's done, and just the short time it's clear. They don't even feel the pains, just that you do it under anesthesia. But of course, the difference it's different in Nigeria or in Africa.
Yes.
Where pain reliefs are not given. The women are not being properly taken care of, if you ask me. Yeah, so they feel pain. So it doesn't have to be painful.
Okay.
Yes, so HSG can be done if there is a need for HSG.
A lot of women dread that, so like the pain. Sometimes when you're talking to them about another person, they're like, I've done HSG. Is it a very painful one? I know that they attribute
so those
a lot
are basic
of
things
pain
that
to
could
it.
be done, but I think it should be selective, not for everyone. If you have a reason to do it, it should be done, and it can be made to be painless. All you just need is to give a cocktail of medications or sedate the patient, and then it goes painless for her. Yeah, I don't think women should be subjected to such degrees of treatment, going through such invasive investigations with so much pain. Yeah.
So viewers, hope and that's for just the basics. Today we're talking about the advanced testing. Well, maybe before we attribute it to while it is needed, what are actually some of these advanced tests?
No, but then let me talk something about the basics. The basics are important because it forms the bedrock of the kind of intervention that a client should have. Like with the hormone profile, for instance, it gives a whole lot of information about the woman, and then it helps in deciding what kind of fertility treatment a woman should have. If you're looking at IVF, for instance, with the hormone profiles, the AMH, and all of that, it helps to tell what protocol of ovarian stimulation. Ovarian stimulation is actually the kind of is a process of growing eggs from the ovaries before they are retrieved. So when you have those basic reproductive hormones, it tells what kind of style of stimulation a woman should have, and how the dosing of her medication should be, and how closely a woman should be watched or monitored during this process. So that's the importance of these basic investigations. And of course, when you go talk about HIV, hepatitis B, hepatitis C, if a man has HIV, for instance, depending on kind of treatment, you could do a special sperm washing. Yes, and like in our centers, for instance, if a man is positive and a woman is negative, yeah, we do up to the point of a HIV testing in the semen.
Wow.
Yes, until the PCR shows that it's negative of HIV.
Wow.
So it's a very advanced kind of so that the woman is not at any risk of anything.
Infected.
Yes.
Wow.
So this is a very advanced way of washing sperms. So every test has a reason why it is done, and whatever you find in the test direct how you go about the treatment. Some of the tests help you in preventing infection to yourself, to clients, and to all the members of the teams. So a lot of tests are actually involved, but these are the basic tests. They are informative. They help to put the treatment in the right perspective. Yes.
So they still form like a bedrock.
That's the bedrock, yeah. But in any case, some people need the advanced testing.
So now we're getting, please viewers, kindly drop your questions. We'll definitely attend to them. If you've not shared this link with someone, please do that right now, because we're about to talk about the main talk for the day, the advanced testing that people require. So now, before we even link it with when they need it or when it becomes important, what are actually some of these advanced testings that are actually recommended sometimes?
Yeah, some of the advanced testings could be things like DFI. DFI is DNA fragmentation index. It's a kind of test that shows whether the DNA content in the head of the sperms are in the right proportion or they are fragmented, because this helps in directing the treatment or what kind of treatment should be done, and help in forecasting or prognostication of the outcome of the treatment. A sperm may be very okay, having good count, good movement, good shape, good morphology, good pH, but have very poor DNA fragmentation, you know, or at a high level of DNA fragmentation. And these are things you don't see under the microscope.
Wow.
So with this, you can tell what the outcome of this treatment is going to be. And this is affecting a whole lot of treatments where they are not being done.
Wow. Okay, so that's for
So
DFI.
Pre-implantation genetic testing can be an investigative modality as much as being a treatment modality. Hysteroscopy can be an investigative modality as well as a treatment modality. Mostly when you have couples who are having recurrent implantation failure, so then you could have natural killer cells assays from the lining of the uterus.
Wow.
Because this could be some immunological reasons why pregnancies may not happen. So these are not tests that are done on daily basis as part of the test before an IVF treatment. So then, of course, the scrotal scan. Scrotal scan to look for subtle abnormalities that could be damaging the sperms, even when the sperms are looking okay. So I think this may just be, and of course, to an extent, even the karyotyping of the partners. Gene profiling of the partners can be done.
Wow. So we have quite a number of advanced testing that Dr. Ken has mentioned. So now we'd look at conditions that warrant this advanced testing. Since you don't just wake up and say this person should do this, something must have actually prompted you to say go and do this test. So what are some of the conditions? Because our topic is when fertility needs those advances. So what are some of those things that require these advanced testings now that you have mentioned?
Okay, if the sperms and eggs and uterus practically look okay, and the hormones during the treatments are fine, because when the hormones are abnormal, treatment can actually be very difficult to achieve a positive outcome to it. But if all these things apparently look normal, and then pregnancy is not happening, you could do a DFI, the DNA fragmentation index. That's one condition. You could do DFI or DNA fragmentation index to see whether the sperms that we assume to be okay or to be normal is actually normal. Then if the sperms are also abnormal, most times we see some of our colleagues feel that so long as you find a sperm, you can just fertilize an egg and you expect pregnancy to happen. It doesn't just work that way. The sperm has to have the requisite genetic integrity. So if sperms are low in count, with poor morphology, poor movement, abnormal shapes and all of that, it would be a good indication to do DNA fragmentation index, because it will further tell you that in addition to the fact that these sperms are looking physically abnormal, they also have problems with the DNA, in which case chances of having pregnancy, achieving pregnancy is poor, and chances of having miscarriages when pregnancy happens is high. So in these cases, DNA fragmentation index could be done. And if the lifestyle of the partner in question looks very suspicious, for instance, so much stress, the time for rest, a lot of alcohol ingestion or consumption of recreational substance like cigar and
tobacco, cocaine, and the likes.
This popular one now, electronic cigars,
the vape,
the vaping and all of that. Yes, you could do all of that because these are oxidative stress that could affect sperms that are even normal in count. So you could do all of this. recurrent pregnancy failure, implantation failure, then poor fertilization rates and all of that. So you could do DNA fragmentation index and take it up from there.
Okay, so hope we're noting this. So, as a man with all this history, if it won't be strange or it's not out of place when your doctor recommends a DFI, he has just made us understand some of the reasons.
Yes, and when a man is old too. When a man is very old.
Okay, men that feel like they never grow old.
No, men grow old now. Men grow old. Yeah.
They feel, sometimes the notion of being the possibility of being able to impregnate a woman till they die. So
yeah, it's there. Men can impregnate a woman to a very advanced age limit. But modern science also shows that as men are aging, their chances or the rate of making a woman pregnant also decreases, just as the woman also have age and have a poor reproductive potential. When men age too, reproductive potentials are lower. The sperms become abnormal. Genetic content of the sperms get affected. Miscarriages would be high, and abnormal syndromes with babies or fetal abnormalities also get higher. So the same thing that happened with women happened to men, just that men will still have sperm to a very advanced age and can still achieve pregnancy to a very advanced age. So, but then it's also good because pregnancies and having babies is not just all about the babies. It's about the quality of the babies.
That's true.
Yes. And so those conditions, aging men and all of that requires investigations, especially with the sperms.
Wow. So we're noting that. So now we've talked a lot about conditions as to why some people would require a DFI. So that's for the men. Maybe now we should move to the women, because I know you mentioned hysteroscopy. Is it everybody that you just feel needs it? Who are those people that you would recommend that for in the course of fertility treatment?
Oh, well, in the course of fertility treatment, a group of people may require hysteroscopy. One, recurrent pregnancy failure, implantation failure, it's one. In which case, you don't know actually what is happening, but then you keep transferring embryos and then no pregnancy. Yeah, you may want to check, to see whether there is anything that ultrasound scan is not peaking. Yeah, that's one. This is pretty straightforward. But then, even from the history of the woman, a good number of women would have been pregnant at some point in time, but would have terminated the pregnancies. And the common modalities of terminating pregnancy is either the D&C, or the manual vacuum aspiration, in which case the lining of the womb is scraped. By the way, these kind of procedures have been badly criticized and has been recommended to be stopped. Yes, for some years now. Though many facilities or many centers do not have what it takes to do the required type of evacuation, which is evacuation under hysteroscopic guide.
Wow.
What happened with D&C or with manual vacuum aspiration is that you scrape the entire lining of the uterus, and sometimes the woman's body doesn't just forgive, so it heals with scars. So when a woman has this kind of history, she requires hysteroscopy. Then there are some kind of fibroid surgeries that will have been done, when the lining of the womb is breached, lining of the uterus is breached, and so it could heal with scars. So they need advanced testing, in which case hysteroscopy would both test and probably do some corrective procedures alongside.
Yeah.
So that's it. So when a woman also had a difficult placenta removal, you have some women sometimes that deliver babies or have some kind of miscarriages at advanced age, and then it's so difficult to take out the placenta. And then you have to manually remove the placenta with difficulty in the operating room. Sometimes this placenta don't just get removed, they also chip off part of the muscle layer of the uterus, or maybe the junctional layer of the uterus, and this would heal with scars. So when a woman has that kind of history, she needs advanced evaluation, in which case hysteroscopy comes in. During the ultrasound scan, if there are evidence evidence is that she has either growths in the uterine cavity or in the on the lining of the uterus, growth like polyps, small sizes of fibroids, or things you don't even understand. You just have to go check. So they need hysteroscopy.
Wow.
And the way we see women these days, it's difficult to see a woman who hasn't had some trouble with the uterine lining. And so the rate of having to do hysteroscopy is actually expected to be pretty high.
So it's not strange as a woman if you've had to go through that. Don't just feel like those, maybe they forced you into it or they cajoled you into it. It's if they don't see the importance, they won't recommend that for you. It doesn't mean that, yes, if it's a test, like you heard him say, it's an investigation. It can turn out to be normal. The fact that it's normal doesn't mean these people just wanted to collect money.
Sure. Doesn't mean you don't
So
need it.
it's just to check and be sure that it's fine. And then if it's fine, good for you. And then if it's not, it means something needs to be done, probably to address it. So
because
whichever
you
way.
see, when IVF fails, we need an answer.
Yes, it's true.
You need an answer.
That's true.
And it's better to know what the problems are before you do the IVF.
Yes, that's true.
Because you just need an answer. If the lining of the uterus is not good, it's very unlikely that pregnancy won't happen. So you need to have an answer to tell them why it's not working. The lining is not good.
Yeah. So hope for those people that have been thinking that should I do this, should I not do this, hope this has given you a good understanding that should it be recommended to you at any point in time, please be open to it, embrace it. And let's talk a bit about PGT, people that you would recommend to go for PGT.
Okay, so now there are some people who still have recurrent pregnancy implantation failure for just no good reasons. You know, everything looks okay, but then you're not having implantation. One of the commonest causes of failed IVF is genetics. Yes, when the genetic component of the embryos are just not in keeping with life. You know, so you could have recurrent implantation failure. And when you've done all investigations and you're just not finding answers, you may just want to do PGD, because PGD, if you do PGD, you will see crazy level of abnormalities with babies.
Wow.
A lot of abnormalities. Sometimes we get PGD results out of 10 embryos, just 2 are okay.
Wow.
You know, just 2 are okay. Wow. Sometimes one, occasionally none is even okay.
And then if you don't do PGT, you can just
be wondering that we don't know why this is not succeeding.
That's true.
Because you see, nature abhors abnormalities. You know, so it takes out abnormal forms of life in the forms of miscarriages or failure to have implantation. So to a large extent, when everything is okay, no problems in the uterine cavity, hormones during the treatment is fine, it may be genetic. Because the eggs themselves, from the age of the woman they're coming, may just be fraughted with a lot of abnormalities. You know, then the age of the man too, with all the stress he's going through, may also come with a lot of abnormalities. So you're having an abnormal egg, abnormal sperm. What do you expect? The embryos may even be blastocysts grade A or the best grade. But that doesn't really mean they're okay.
It's true.
And then you hear, oh no, when embryologists say, oh, this is blastocyst A, it's going to be just be watching, because genetics may just not be in favor of pregnancy. So you need to do PGD in this situation. You understand? So it gives you answer to why all the things that have been happening, and it helps you to make the right choice. Because then with PGD, you can pre-implantation genetic diagnosis, screening and testing, you can make a right selection of a healthy baby with the right gene components, and then the chances of pregnancy is high. You know, so but that is very expensive. But if you ask me, there's no amount of money you spend in having a child or a baby that is expensive, so long as you have the money to spend. You understand? So, and more importantly, there's no amount of money you spend for health reasons that is also too expensive, so long as you get the results you're looking for. So to the PGD or PGS, PGTS, it's just a very, very, very advanced testing. You understand? You know, when we started doing PGD, you understand, and we started looking at the qualities of embryos, it was clear to everyone that a good number of embryos are just not it.
That's true.
Yes. But because it is not easy to do it,
Exactly.
you don't just do it. You just make do with the physical things you see. So
Yes.
PGD, oh boy, just the way to go.
So those people with the genotype people, do you see them and just recommend the PGT straight
Oh,
up?
that is straight up. PGD straight up. Except they
For
want to
them.
take chances. But so long as they want to do IVF, it's advisable to do IVF with pre-implantation genetic diagnosis, because with PGD, you could select a baby that has the normal healthy genotype. And then the risk of having a sickle cell hemoglobin SS is taken out completely. So yeah, they could also have PGD.
So hope viewers, we've gotten to learn a lot about why some of these advanced testings are also required. We've also gotten to know what are possible things you could find when a man actually goes for a scrotal scan.
Yeah, quite a lot actually. You know, sperms are a lot more abnormal these days. And let's put it in the right perspective. These days, it's very obvious that more miscarriages happen because of abnormal sperms than abnormal eggs.
Wow.
That is where the current stand of the world is.
Yes.
So the life of man is actually in danger. You know, so when you have, like in our center, for instance, when sperms are abnormal, we don't just take what we see. We try to look for what's causing it. So we go to examine the testicles for abnormalities, scan them for abnormalities, the Doppler scan for abnormalities. So when you do all these scans, what you could see may be collection of fluid around the testicles.
Oh, okay.
In which case, it means the testicles or the sperm, the storehouse of the sperm is exposed to abnormal level of heating. Now, you could also see abnormal blood vessels, which also means they are exposed to abnormal level of heating and stagnation of removal of metabolites that could be harmful to sperms. You know, then oxidative stress will also follow. So you see the fluids, a situation we call hydrocele. You see the abnormal blood vessels, tortuous occasionally, either on one testicles or on both. You know, a situation we call varicoceles. You know, then you could even have the size of the testis itself. You know, there are some times that these testes have a salient genetic programming that they just become smaller, you know, or even soft, you know. So it just shows that the function has been programmed genetically to wane down. So you have a lot of information coming from all of this, and you fix as much as can be fixed. You know, otherwise you'll be dealing with poor sperms. Yeah, you'll be dealing with poor sperms, and then of course it can affect the outcome of a fertility treatment. But there's just so much about the sperms. Yeah.
Okay, so I'm forced to ask: are there times that you recommend laparoscopy? Maybe are there times that you feel it's necessary for a woman to have a laparoscopy now? Like, okay, with respect to fertility, are there times that you feel a woman needs laparoscopy?
Yes, you know, women usually have a lot of investigations before going for IVF. You know, okay, we are a referral centers, for instance. Usually, when they've been to the public institutions, they would have had HSG, and HSG may have shown that the fallopian tubes are blocked, or would have made some diagnoses that are just not healthy, like possibility of hydroceles. I mean, is it?
Hydrosalpinx.
I said hydrocele.
Hydrocele, because we just talked about the sperm. We just talked about the scan. So.
Hydrosalpinx, yeah, which is collection of fluid in the fallopian tubes. You know, so you may want to do a laparoscopy to confirm that. And if it is really so, you may have to take out the fallopian tubes. Because this fluid that is collecting there can actually track back into the uterine cavity and can physically wash out any embryos or primitive cells, or can just poison the pregnancy in the primitive state and you could lose the pregnancy. So laparoscopy may be helpful. Then, of course, if a woman has endometriosis, you may want to do laparoscopy to help to take care of the endometriosis, because endometriosis untreated can reduce the chance of getting pregnant, can reduce your possibility of producing eggs. And the chemicals from endometriosis can also be negative effect on pregnancies. So yeah, laparoscopy can be important.
Wow. So viewers, hope we are noting that. So
and these are actually quite advanced things to do.
So just in case at any point in your fertility journey you've been asked to do any of these tests, as the man, as the woman, you can see that it's essential. It's not because they just want you to do them. They are very necessary at the point they are recommending them for you. So well, as we wrap up on this show today, what's your counsel to people with respect to how they actually embrace accepting to do these advanced testings and no?
Usually when clients calls and they come in for fertility care, they just think they'll come and just have it done immediately.
Exactly. That's true.
Well, it's a knowledge gap. I've seen quite a number of people who come and they say, we came here for IVF. We didn't come here for investigation. Yeah, but man, you cannot have IVF. You have to be investigated. So it means there's just this knowledge gap. First of all, they have to be investigated and evaluated and the body checked, the system checked, all investigations done and program your body for whatever needs to happen. So people should keep an open mind. But in situations where they don't understand the reasons for this investigation, I think they can engage the healthcare provider, to understand why these things are necessary. Because when they understand it, they would have good reasons to permit for it to be done. So I think that's just my only counsel for them. And they shouldn't be worried when investigations are mounting and piling. The investigations, as you mentioned earlier, may not necessarily find out any bad thing, which is okay. Investigations are not supposed to be bad. The results are not supposed to always be bad.
That's true.
Because it just reassures us that yes, there's no fear for this. We should go ahead. And of course, if we see any bad thing, it tells us there's something bad we need to check, we need to deal with. So investigations may just not be positive, it could be negative. So whichever way it is, your experts should be able to lead you in a way to deal with such findings. So investigations are quite good.
So please be open to investigations.
Because you have some clients, when they have these investigations and they're all normal, they not tell you, I told you I don't need it.
Exactly.
And now you're doing it. No, it's not so.
Yeah, so it's not, nobody is just trying to make you go through them. If they don't see the need, they would. I mean, at least we know that for Alps Hospital, if anybody in Alps Hospital as a fertility specialist tells you, we need you to do this investigation, of course, it's from the point of wanting to know what the best modality of treatment would be for you, to find out if something needs to be addressed. So please trust your experts like we have at Alps Hospital to actually give you the best of counsel. And please be open to it, because we are all after your success. We are all after you achieving your fertility dreams. So please embrace it with good faith and hope for the best from it. It's been amazing having you, dear viewers. Stay tuned with us today. Thank you for engaging us. Thank you for always staying glued to our screen. We're always available. You could chat us up, or you could send a message, book an online consultation, or visit us at any of our centers in Alps Hospitals Abuja or Alps Hospital Jos. I mean, you could also get our addresses, various websites on our handles, and you definitely be happy that you actually did meet us. Thank you so much, viewers. Once again, we hope that you have a lovely evening, and it was good to have you, Dr. Ken. Thank you so much.
My pleasure, always.
Bye.